Hello, my name is Rihanna Clark, and today I'm going to be discussing prisons being used as mental health care institutions. This issue is important to me because I have been in a position to see the issue firsthand. I worked directly with inmates who were released to IRTS programming as mental health patients from jails and prisons. My job was to help them learn and deploy coping skills to maintain their mental health symptoms and transition back into the community. The impact on the individual is a cycle of being in and out of prisons due to not being able to find stable work and housing in the community. This was often a result of their criminal record and their mental health symptoms not being well controlled. After they are discharged to a lower level of care, it's difficult for them to reintegrate back into the society without ending up on general assistance or long-term disability simply by not being able to find stable housing and employment. The goal of advocating and exploring this issue is to focus on assisting men and women who have been caught in the cycle of repeated arrests for mental health issues and related crimes reintegrate into the community with higher confidence in their ability to maintain their mental health symptoms and hold stable employment and housing. The position that I'm taking on the issue of prison systems being used as mental health care systems is that this is a real issue, and it affects not only the individual who is struggling with mental health issues, having to receive care in an inappropriate setting, but also the taxpayers who are funding the prison system and the inflated cost of this care in the wrong setting. This care was previously out of the scope of practice, and training was not needed until the need was presented. There are avenues that we can explore also in prevention as a solution to this problem. My social advocacies group position is that there's a disproportionate number of inmates who are better classified as patients, who are in need of mental health and stabilization services rather than punishment or correctional programming. There's a disconnection between policy or the powers that may be and society. Society realizes that mental health care is seriously lacking in our communities and is replaced with punishment. The evidence that I will be pointing to in this presentation is provided by the American Journal of Criminal Justice in an article that is titled, "Is the Defendant Mad or Bad?" written by Sahoni, Potowska, and Page in 2025, that explores the impact of mental health issues in sentencing. Another is from the Vera Institute of Justice, titled "The United States Criminalizes People Who Need Healthcare and Housing" by Bryant in 2018. This article showcases the data on the number of inmates who are more accurately classified as patients rather than criminals. The sociological theory that I will be applying to the issue of prisons being used as mental health institutions is the conflict theory. Rather than implying that there is something inherently wrong with the patient or inmate in this case, it focuses on those in power who create the policy and legislation to control those with mental illness by underfunding vital resources and services, creating a school-to-prison pipeline, and creating the prison industrial complex. The mission statement for my proposed advocacy group, Mission Cycle Canceled, or MCC for short, is mental health advocacy group whose mission is to end the cycle of prisons being used as mental health institutions, saving money and lives by assisting people in obtaining the trifecta of security: healthcare, employment, and housing. If we look at the numbers provided by the Vera Institute of Justice, it shows that the Los Angeles prison system is actually the largest mental health provider in the United States. The prison system in the United States houses 10 times more mental health patients than state hospitals do. This alone highlights that the prison system is better funded, though less ethically equipped, than the mental health care system. It takes an average of 48 days to gain access to mental health services, and when someone waits that long for access, it is often the case that the patient cannot even afford the care. Now, if we look at the information that's provided by the American Journal of Criminal Justice, it shows that previously diagnosed mental health disorders clearly impact sentencing as well. For example, there are some mental health disorders, such as depression, associated with crimes that are often classified as drug crimes, where the defendant will get a lesser sentence based on the mental health disorder, age, and gender than an offender with no previous diagnosis. However, looking at disorders like PTSD, the sentence can be inflated due to that diagnosis. If we go back to the example stated before, we can compare the difference in sentencing compared diagnoses with depression and PTSD. Depression is generally considered a dangerous condition for the person who is suffering, whereas PTSD is often stereotyped as the person being unpredictable or a danger to others. And this is proven wrong by the CDC in 2025. This not only impacts their sentencing in a court setting, but it also carries a stigma along with a negative stereotype. Some mental health disorders can blur reality for those who are suffering from it. Conditions like PTSD, schizophrenia, and some others can impair one's ability to distinguish real danger from their own mental health conditions. This is a dialectical issue because it is true that someone suffering from mental health can be in danger. However, it does not prove that all people with these disorders are a danger to themselves or others. The problem with stereotypes is that they label people and they spread fear when they should be a proverbial neon sign to the rest of society that this population actually needs more assistance and support instead of punishment and damnation. The stereotype around this issue is that those with these mental health disorders are dangerous, violent, beyond saving, or that they are criminals in general. This is according to Norman in 2014. In all reality, they are usually arrested for petty crimes such as stealing basic necessities or loitering due to being unhoused and needing someplace to be for their own health and safety. Social change around this issue began years ago when the realization was had that this was a problem. There have been studies, papers, and mainstream stories for years that have brought some awareness. There has also been some policy changes and funding allocated as well to the treatment and the care provided to those who are incarcerated with mental health issues, and programs built to assist in the process of reintegrating these individuals into society. You can see some evidence of this in the session outcomes, expanding behavioral health care capacity, improving access overview in 2024. For example, in my state of Minnesota, there was an influx of programs called IRTs, or Inpatient Residential Treatment Programs. These programs are basically funded by the state, even though they are not government nonprofits. Most of their residents are referred there directly from jails and prisons, where mental health services are paid for by the state to receive structured residential mental health and substance abuse services for around 90 days, usually also funded by the state insurance after discharge. As they transition back into the community, these facilities are also funded mostly by grants from the state. So a lot of taxpayer money. The historical interpretation of this issue is that there is a gap in healthcare left behind by deinstitutionalization during the humanitarian movement of the 1950s and 60s. The intention of deinstitutionalization was good. However, there were many people discharged to the street with no plan for housing, therapy, or symptom maintenance. The modern view remains the same. We know that deinstitutionalization was the cause of the influx of mental health services through the judiciary system. Not only do the timelines coincide, but the growth of this specific population can be proven through data, statistics, and surveys taken over the past 20 years or so. We are also aware that incarceration exacerbates mental health symptoms and can actually cause mental health issues as well. Both the historical and the modern view on prisons being used as mental health institutions point to the conflict theory. Criminalizing those with mental health disorders reinforces the idea that there is a systematic failure. The powerful damning those with mental illness, locking them away without proper care, is the equivalent of the institutions that they closed during the humanitarian movement. Prisons are the new government-funded asylums controlled by those in power as a way to ensure control over this vulnerable population. The prison system is basically a wolf in sheep's clothing to pull the wool over society's eyes, allowing us to appear to be breathing easy, thinking that we abolished insane asylums for human rights and dignity. To explore some ethical considerations and issues that I have come across in researching this issue, they consist of the prison staff not being equipped with the proper training or experience in providing mental health services, or being able to recognize when an inmate is showing mental health symptoms or if their symptoms are being exacerbated. This could be addressed by providing training to law enforcement and prison staff on recognizing the signs and symptoms of mental health disorders and identifying the exacerbation of symptoms and how to de escalate them. Not only recognizing and de escalation processes, but also knowing their own scope of practice and when to escalate the issue to somebody who is more equipped and better trained to address the individual's needs when they are noticed. Another ethical issue that treatment of inmates can cause and exacerbate the symptoms due to treatment, living conditions, or the fact they are in the need of mental health care but do not have access, which led them to be imprisoned, as opposed to being admitted to a hospital for proper care. This can be addressed by screening the individuals upon retaining them to determine what kind of services they need. Is it healthcare or is it punishment? This process would broadly highlight the societal need for more funding and expansion in healthcare instead of the prison system, such as increased access to crisis services, inpatient facilities, residential services, and other mental health services. It could potentially unblur the lines between healthcare and imprisonment by making the prison system a proven unfit provider of mental health care by data collection and calculated statistics as a whole, allowing for more advocacy, policy, and major change to our healthcare system. In summary, deinstitutionalization directly dismantled our mental health care system and left those who suffer without a place to receive stable long-term services. Our healthcare system is majorly underfunded, and our prison system is grossly overfunded for all of the wrong purposes. Meanwhile, social norms and legislative policy keep the cycle of re-imprisonment of those with mental health disorders intact. Possible solutions to this problem and repeated cycle include incorporating more mental health, evidence-based, and coping skill acquisition services in early life by providing them in a school setting. This will provide universal opportunity for early intervention and treatment. Another solution would be screening those arrested upon arrival for mental health symptoms to discriminate which services are needed before imprisonment has a chance to exacerbate or cause mental health issue escalation. We can also advocate for human rights as it pertains to mental health and access to healthcare, pushing for more funding in healthcare and less for the judicial system. After all, if we can get people proper care, the prisons will not need all of the funding that they currently have, and they will not need to be trained or deal with situations that are out of their scope of practice. In conclusion, my position is that the prison system providing mental health care is inappropriate, and it ruins people's reputation and chance for a future when they obtain a criminal record for simply struggling with their mental health and are forced to seek care in the wrong setting. I believe that with strong advocacy, we can create a movement of social change that calls for more funding in healthcare, early intervention, mental health services, and rehabilitation as a replacement for the underfunded and overutilized judicial system that has been historically overused as a method to criminalize mental health disorders. I wholeheartedly believe that we the people can be the change that we need to see.